The other thing that now we're recording. Welcome to those of you just joining us on the recording. The other thing we're doing today is launching a new case study section on our website. And so we've been beavering away in the background trying to make sure that we capture some of the really wonderful practice that's happening across the Health Anchors Learning Network. There's a huge number of participants, and many of them have been working with us to kind of document their learning and their approaches so we can share and spread those more widely. And on your screen, you'll see where you can find that on the Hown website, and really would encourage you to go and take a look. There's some fabulous work happening across the UK, and I'm really pleased that we're able to start bringing that together in case studies to kind of share and spread that learning. And we'll be adding to that over the coming months, so there'll be more and more coming your way. So the way we're going to do this today is a fairly quick run through. We're going to hear for between 5 and 10 minutes from each of the 5 case studies. And I'm going to come in and give people a quick 1-minute warning just when they've got their last minute or so they can say anything else they want to say. And I think we'll finish probably on the dot of 1:30. It is going to be quite short and sharp because there's a huge amount to cover. I hope you're going to leave today fizzing with ideas and inspiration. There's some really, really wonderful content ready to be shared. And as Jahan has just added into the chat, you can also click on that link and download some of the case studies. Great to see some of you introducing yourselves in the chat. If you've just joined us and you haven't done that yet, do come in and say hello. But I'm going to start by moving us on to the first person speaking today, who's Chris Sanderson, joining us from NHS Greater Glasgow and Clyde. So Chris, go ahead. I'll come in and give you a shout when you've got a minute or so left. But yeah, over to you.
Okay, thanks very much. Got a presentation here which I'll try and get through in 5 minutes. I've kind of shortened it from something I've given before. Yeah, I'm Chris Sanderson. I'm head of procurement here at NHS Greater Glasgow and Clyde. I think I'm getting the impression, obviously, there's colleagues across the UK on this call today. So you know, obviously in Scotland we have I think something like 20-something territorial health boards. 20 odd health boards, of which 16 cover a territorial area. So NHS Greater Glasgow and Clyde is the largest of the boards in Scotland, we have a budget of approximately 3.8 billion per annum, so it's quite a large organisation with something like 40,000 employees. So I'm head of procurement here, and I have been for about the last 18 months. Today I'm talking about a project where we commissioned an organisation called the Supplier Development Programme in Scotland. So the Supplier Development Programme are an arm's length or agency, if you like, from Scottish Government, and their reason for that they exist is to work with small medium enterprises in Scotland and help them improve their capabilities around tendering for public contracts that the public sector put out to tender in Scotland. We move on to the next slide. Just this is about the drivers about why this initiative, why we wanted to do this. We do have a desire to look beyond traditional procurement metrics into sort of wider societal benefits of procurement spend. Increasingly, and procurement teams are linking with our public health improvement colleagues. There was a report, it was called the Tide report in July 2021 here, and that recommended looking at procurement practices to strengthen more inclusiveness in the supply chain by engaging more with businesses owned and led by people from diverse backgrounds, and to try and increase diversity within the supply chain. Also, so that's the kind of bit about looking beyond traditional financial metrics. In terms of legislation in Scotland, we have something called the Procurement Reform Scotland Act, and it has some general duties in it around sustainability, supported businesses, and specific duties around community benefits. So that's to do with what we need to consider when we're undertaking tendering exercises, but also just a general duty about considering the social and economic benefits to societal benefits around procurement activity. And just generally within our procurement strategy, we wanted to, we've got some market intelligence about our local SMEs, but we wanted to learn more about our SME base. And you know, it's just part of our strategy to see if we can work more with local suppliers. Just moving on to the next slide. I won't dwell on this, but it's just to show you that this is a breakdown of our third-party supplier spend on the board. Last financial year we spent £764 million with suppliers, so it's a big chunk of spend. You know, about a third of that was within the category of pharmaceuticals, but then you move into categories which unsurprisingly for a health board, you know, medical devices and clinical consumables, medical equipment. Some of this is covered by national contracts, and some of it's local contracts, but it was just to give a kind of overview of what we spend our money on. Go to the next slide. In our board, we're able to measure, and we have a system, won't go into details, but it allows us to understand the amount of our spend with, in inverted commas, local suppliers. It's based on the invoice address that the supplier's invoicing from. So just to put that caveat out, so but based on that data, it does allow us to have a view as to the extent of our spend, which is spent with suppliers that are in our local authority areas within our health board footprint. So in 2021, in our health board, we spent almost 77 million with suppliers that are in these local authority areas. And then in last financial year, that it did rise, it rose by 15 million, but so did our overall trade spend. So basically throughout the 2 years, it's sitting about 12% of the spend is with, we can see is with local businesses. You want to move on to the next slide? So as I say, we commissioned the supplier development program, and we applied for a health foundation grant, and we were successful, obviously. And we had the option, we could have recruited somebody locally within the team, but the supplier development program, like I say, this is their kind of bread and butter in terms of what they do. So we chose to commission the supplier development program, and working with them over the last kind of, well, really since January, but the main activities have taken place from May onwards. We've conducted 6 webinars. We've had 136 attendees from 127 SMEs. We've done 2 speaking sessions at a couple of procurement conferences that are listed there. The SDP created dedicated pages to host information about the project. There's an NHS support wall. I won't dwell on it because I've got limited time. And we also were starting to select certain tenders that we knew were on our work plan, which we thought may attract more interest from SMEs, and we're using the supplier development programs, advertising and reach amongst the SME base to make them more aware that these tender opportunities are out there.
Just a minute left, Chris.
Okay, good. I've got 2 slides, so I'll quickly rattle through them. Next slide then. So outcomes so far then. 87 Scottish SMEs attended the webinars, identified as over 50% owned or led by individuals with protected characteristics. Of those SMEs that responded to the surveys, 81% of them were more likely to bid for future public contracts as a result of participating in the events. For those contracts selected for enhanced promotion by the supplier development programme, there has been some evidence of greater SME participation. And as I said before, our SME trade spend, it grew in absolute terms, but between 2 financial years, but it's roughly the same in percentage terms. And final slide. So in terms of the future, it's now obviously the grant funding is non-recurring in nature, and we're starting to think now, you know, how do we sort of try and embed some of this into business as usual? I think the funding model for the SDP in Scotland is an issue because the boards have to individually fund or pay for this, and actually earlier on today we were on a meeting about whether this is something that could be Scottish Government themselves could potentially fund, so that all the health boards could access this type of support and process on a kind of equal basis, and do it on a pan NHS Scotland basis. Some lessons learned from the approach that we could adopt into our business as usual is, you know, what we're starting to do now is signpost suppliers to the supplier development programme resources within tender documents. We're looking at what some other organisations do, which is we under 50k procurements which are not regulated, we would do using a competitive quotations process, and we use a thing called quick quotes. That's where we invite a group of suppliers to submit a bid, and some organisations are ensuring that as a minimum there's at least one of those organisations or more that are local SMEs. So that's a kind of thing that we could incorporate, and also just you know, we're making sure we update our tender strategy to further highlight to our procurement officers to ensure that they consider, breaking contracts into smaller lots if they can do that, which would, encourage more SME participation. It's something that we've always had, but we're just trying to emphasise that as well. So it's a little bit tricky, if you don't have the funding recurringly, how do you sort of mainstream some of this? So we're trying to look at that. But that's essentially in 5 minutes, hopefully, what the project is about. So thanks very much for listening.
No, fantastic. Thank you, Chris. It is really wonderful. I think you've covered the key points really well there, and I can see some kind of comments and feedback in the chat, which is great. And there's some really practical lessons learned there, which is always useful to hear. And we're kind of not departing too far from procurement, actually. We're going to move from Glasgow and Clyde into East London, into the East London Foundation Trust. And Una is going to join us and talk a little bit about the work they've done evaluating and embedding social value into their procurement function. So welcome, Una. I'll hand over to you. And again, I'll give you a minute's warning when you've got 60 seconds to go.
Great, thank you, Julia. So I'm presenting today on behalf of the work we've done at East London NHS Foundation Trust to evaluate our implementation of social values in procurement that I've worked on with my colleague Angela Bartley, who's the consultant in public health at Elft. Next slide, please. And next one. So just to give some background on East London NHS Foundation Trust, Elft, it's a community and mental health trust that provides children's and adult services in East London, Luton and Bedfordshire. It's a large trust. We serve nearly 2 million people and we operate from over 100 community and inpatient sites. And we serve some of the most deprived boroughs in London and in the country. Next slide, please. As an anchor institution, we've got 5 social value priorities, which were voted on by our Council of Governors in 2020. So as you can see highlighted here, they are firstly ensuring our suppliers pay the real living wage set by the Living Wage Foundation. Secondly, investment to grow and retention of spend in local economies. Thirdly, creation of equal employment and training opportunities for local people, people with protected characteristics, our service users, and groups hardest hit by the COVID pandemic. Number 4, commitment to sustainability, including reducing carbon emissions. And number 5, support for young workers, school leavers, and apprenticeship schemes. Next slide, please. So in 2021, we first began to implement these social value priorities in our procurement process. And the first 2 contracts we procured with a 15% social value weighting in the tender evaluation was a contract for website and intranet development, which was awarded to a SME called Big Blue Door. And the second one was for soft facilities management, such as cleaning and catering, that went to a multinational corporate called OCS. And you can see at the bottom of the slide that, an example of the difference that this approach can make to people's lives is that there was a £185 increase in monthly take-home pay for domestic cleaners or porters on the new soft facilities contract. Next slide, please. And again. So we used our Test and Learn grant to commission the strategy unit, which is a specialist NHS team in research and analysis, to carry out an evaluation of the implementation of our social value priorities in the procurement and delivery of those 2 initial contracts, with Big Blue Door, which is an SME, to develop our intranet and website, and with OCS, the multinational corporate, for soft facilities management. So there were 3 key aims of the evaluation. Firstly, how well were social value priorities applied in our procurement processes? Secondly, how are suppliers implementing those social value priorities in practice, and are there any barriers to implementation? And thirdly, how to measure social value outcomes more effectively. So it involved qualitative research. It was a process evaluation rather than an impact evaluation. given the short time frames since contract award. And we included 3 key perspectives. So our perspective at Elft as a commissioner, our suppliers and our service users as the intended end beneficiaries of social value implementation, along with members of our community more broadly. Next slide, please. So the methodology consisted of interviews, focus groups, and surveys. The research was carried out over summer 2022. 7 interviews were conducted remotely with social value leads from Elft, the 2 suppliers, and a regional stakeholder from the North East London ICS. In terms of focus groups, there were 2 carried out, one with members of our procurement and contracts team at Elft, and one with 19 service users. And in terms of the surveys, that reflected perspectives of service users and the second survey of suppliers. And that included additional suppliers, not just the 2 contracts that we examined in more detail. Next slide, please. So 3 key themes emerged from the findings of this evaluation. Firstly, in terms of social value implementation and measurement, it became very clear that smaller suppliers in particular can lack understanding and experience of how to implement social values in practice. They reflected that there's a need for greater clarity around how to implement our social value priorities in practice, including having clearer guidance documents and earlier dialogue in the marketplace with the procurement process. In terms of the different social value priorities, they were better understood in relation to environmental sustainability and anti-slavery than to addressing health inequalities and barriers to employment. And in terms of measurement, there was consensus for greater flexibility in how we define social value KPIs, that KPIs should be co-created jointly by commissioner and supplier, and that we should not have a prescriptive approach to performance measurement. That's reflected there in the quote as well. And taking a prescriptive approach to KPI performance measurement, it goes against the spirit of social value. Next slide, please. The second key theme was in relation to operational considerations for social value implementation. As you can see from the first 2 points on the slide, that revolves a lot around staff resource. So suppliers said they do need additional staff resource to manage social value responsibilities and implementation. And obviously that gives larger suppliers who have more resource a competitive advantage. Elft itself has limited staff resource to support social value implementation in procurement. And there was a suggestion made that we create discrete social value roles rather than just adding a social value dimension to existing roles in the contracts and procurement team. That, however, would carry a risk of social value expertise being concentrated rather than spread across.
Just another minute there, Una.
Okay. And you can see there that suppliers highlighted the usefulness of having a single toolkit for social value procurement, which would go back to that need for greater clarity around how to apply social values in practice. Next slide, please. Third key theme, it was again coming back to that inequality between smaller organisations and larger organisations in terms of resources and expertise needed to develop their social value proposition. So it came out very clearly that we need to do more to address that inequality for smaller suppliers, because we can have an unintended consequence of this approach that we work only with a small cohort of larger companies who have the extra staff resource that gives them a competitive advantage in bidding. Okay, next slide, please. So
after this, I might have to move us on, but go finish this slide.
Okay, this is my last slide. So in terms of where we're going next, we're implementing the recommendations that came out of this. Firstly, as I already mentioned, it was to develop a toolkit for social value procurement. This particularly targeted at smaller suppliers to address that inequality in expertise. We want to consolidate service user involvement in the approach, as they are among the intended beneficiaries of the approach. Thirdly, more market development activity to support those local, smaller and voluntary sector organisations in social value procurement. And lastly, it was about working more with the ICS to formalise their approach to social value. Came out that there wasn't a unified approach across North East London ICS. And they have this new role in intelligence gathering and providing think space about a social value approach in procurement. Thank you.
Fantastic. Thank you so much, Una. Really lots to think about and take away there, and very much building on some of Chris's reflections, and really wonderful to see the data and insight that you've been able to gather through your work in this space that's then helped inform you and develop some of those practical tools to help market development and engage some of the more kind of small to medium-sized organizations where we know there are often barriers to entry. So wonderful. Let's move on. We really are galloping, aren't we? But hopefully there's lots of food for thought coming out to you. And there is the chat if you want to add any reflections or thoughts in there from your own experience. I'm going to introduce Kelly next, who's joining us from Doncaster and Bassetlaw Teaching Hospitals Foundation Trust. Kelly, you're going to be talking a little bit about the Foundation School for Health. So really thrilled to be hearing about this. And I will hand over to you. And again, I'll give you a 1-minute warning when we're there.
Thank you. So hello everybody, I'm Kelly Turkwood. I'm Vocational Education Manager over at Doncaster and Bassetlaw Teaching Hospitals, and here today, as has just been shared, to share with you our journey in introducing the second foundation school in health in the UK, a first for Bassetlaw. Move on, please. Thank you. So just a little bit about us. I know we are tight for time, but we find ourselves in a unique situation where we straddle two ICSs. So we serve the people and the communities of both Doncaster, which is an opportunity area, and Bassetlaw, with a total population of 440,000 people. We were established as an organisation in 1792. We have 3 main hospital sites, with Doncaster being our flagship, and employ over 6,800 staff. Of those 350 career professions that we know that are accessible in health, we estimate that 250 of those are accessible at DBTH. Next slide, please. So for us, we were keen really to ensure that we were providing access for all of our communities, both our young people and people from the wider communities, more so following the publication of Health Education England's Widening Participation It Matters document. And at that time, we kind of wondered and explored, how are people getting in? What are the points of entry, and what is the work that's happening with schools? And over the recent years, you know, we've really focused on ensuring that we are reaching out to our communities and our young people, because it's critical that we ensure that we've got a workforce fit for now, but also for the future, ensuring we've got people with the right skills, the right values and behaviours, but also ensuring that we've got a workforce, given that we have such a large workforce that reflects and serves the community that it serves. So we want to achieve our anchor institution ambitions by providing better jobs and resulting in better health outcomes, but also ensure that there's equal access to careers in health and care for all, regardless of background, age, and so forth. But also, it's really important that we get out there and change the perceptions of our communities, raise the aspirations to support recruitment and retention of people stepping into careers in health and care. Next slide, please. So why a foundation school in health? People ask, what is it? What were we trying to achieve? And back in 2018, we did introduce the first one over in Doncaster, and we wanted to introduce the second not long after, but with COVID, our plans were halted. But the purpose of the foundation school in health was to develop a model of engagement between employers, not just us, but us and other health and care employers, and all schools across Doncaster and Bassetlaw from year 7 upwards. what we found were often we struggled to reach into schools, schools struggled to reach into us unless they knew somebody in the organisation. And what we wanted to do is make those opportunities more fair for everybody and consistent, and ensure a quality governed process in doing so. Next slide, please. So after we started to move from through a period of recovery from COVID, we felt it was the time to introduce the second foundation school in health in the UK, but a first for Bassetlaw, to offer our young people over in Bassetlaw the same opportunities as the people in Doncaster. We approached the foundation, the Health Anchor Learning Network, who supported the project, the initial startup of the project, and Sept in presenting them with a project timeline and a proposal. In doing that, the next two things really came hand in hand. We needed to identify a school, but to do that, we also needed to get approval from our own executive team and the board of the school, of trustees. So they kind of happened simultaneously. We kickstarted the project in April of this year, and the first part was to recruit a project support officer to help us with the launch and the initial planning of the partnership. Unfortunately, we failed to recruit into that post, but we continued with our commitment to introduce a foundation school in Bassetlaw and progressed in identifying the school, which was Retford Oaks Academy. We'd worked very closely with Retford Oaks over the years, and they had expressed an interest previously to become a foundation school in health. So we obtained the relevant approval to move forward with that, and the Foundation School in Health in Bassetlaw was launched on the 12th of October. The difficulty and the risks associated with the model is sustainability. We have 29 secondary schools in Doncaster, approximately 10 over in Bassetlaw. So it's ensuring that we can reach into all of those schools and offer equal access to the opportunities to be had. So working with the foundation and school will help us develop different types of opportunities and activities that we can share with all schools, so all young people have access to careers in health and care. Just move on to the next slide, please. So what we've done with so far is we have been able to invest in the future workforce by providing opportunities to get in. The introduction of a work experience framework is a byproduct of the partnerships. We also have facilitated and are now planning an event this summer, both at Doncaster and Bassetlaw, again the first of its kind, showcasing the whole range of careers in health and care. The event itself, the Weekend to the Future event, will feature a simulated corridor showcasing a patient journeys, where all Year 8 students from across Doncaster and Bassetlaw will be invited to partake in the event from all of our schools, so nobody will be left behind and everybody will be included. That will then provide them an opportunity to explore the whole range of career options available, including procurement, finance, all the different types of roles, because often our young people will often count on one hand how many jobs are available to them in health and care, and we know there were far, far more than that. Evaluations from the event this year demonstrated a marked improvement on awareness of careers and opportunities in health and care. And we hope this year in summer 2023, and the planning has begun to recreate that event, not only at Doncaster, but also in Bassetlaw for the Year 8 students. Other things that we've been able to start since the partnership began in September 22 with the Foundation School in Health at Bassetlaw is the students are now working with staff from the organisation to develop a web page for all schools, teachers and parents to be able to access and be interactive. And they've joined us on other innovative activities such as our place assessments, whereby indirectly they're getting insights into the careers and opportunities in health and care without atypical to your usual work experience opportunities. Next slide, please. So these are just some of the images of the students and the things that we've done with them in the We Care event. But we hope that the partnership, which we've got a 3-year plan, will go on from strength to strength. So this bit that's been supported is only the start of our journey in raising those perceptions of our young people, raising the aspirations and challenging the perceptions of our young people, and really helping them see what opportunities are to be had for them within health and care as they progress through their school years. And that's it.
Oh my gosh, with 30 seconds to go, you win the timing medals. Thank you so much. That's fantastic. Really wonderful to hear about that. And it's great to hear about an example on kind of recruitment, staffing, workforce, which comes through again and again as one of the major anchor challenges that people, or kind of opportunities really, actually, that people are grappling with across Hound. Thank you so much, Kelly. Kevin, welcome. We're going to be hearing from Mid and South Essex next on the 2050 Ambition project. Really thrilled that you're bringing this here, Kevin. So I won't say anything other than to hand over to you. And again, I'll give you a minute warning once we're at that time.
Thank you, Julia, and good afternoon, everybody. I'm bringing forward a project that isn't a Health Anchors Learning Network funded project. It is part of the management arrangement that our Anchor Youth Partnership sits underneath the Anchoring Southend work in large measure from a delivery and management perspective. So I'm Kevin Gowd, I'm the Anchor Programme Manager. Just at the outset, Anchoring Southend Ambition. The ambition was to be a city. We achieved that as Southend in less than ideal circumstances in some respect, but this is about our journey towards being a city in the UK. So next slide, please. And I also apologise slightly for this one. It's a bit upside down in the sense maybe I could have shown this later, but I wanted to show colleagues actually how increasingly the Anchor in Mid-South Essex is presenting its work to those people who are making future and funding decisions, so about drawing in our input and then defining our outcome. But the rest of the slide set, if we can move on to the next slide, please, will, I hope, bring some of that to life. So what was Anchoring Southend 2050 Ambition about? It was about supporting people who were unemployed from disadvantaged communities and backgrounds towards work in the NHS, not exclusively to Southend Hospital, but Southend Hospital provided that sticky capital that anchors are famous for. So we bought the jobs and we wrapped that around what was already going on from the employment support provider market. We based it on an accredited model that has received long-term NHS investment, but we've adapted it to the use across the community. And just to reflect on the numbers that I showed you, on average, on any one day in Southend, there are about 800 people seeking work and formerly unemployed. So that sets us up for providing some work readiness into that. And if we can go on to the next slide. Thank you. So we have, therefore, the preparation, if you like, the actual seeking of work, and then really importantly from our perspective, the sustaining it, the holding on to it. And the work that we found people has generally been at entry level, but it's not just HCAs or HCA support workers, range of different backgrounds, admin, EFM. We have at any one time across our 3 hospitals about 2,000 vacancies. So even in Southend, there's a considerable churn, and we were also ensuring that we weren't just located on the hospital, that we were reaching the healthcare family, if you like, around Southend, where we have lots of challenges from our social care workforce in terms of the paucity of people coming into that. And we also targeted people who were long-term unemployed and had many barriers to work, as much as we did people who had just lost their jobs. So the planning for this was a post-pandemic arrangement where unemployment was likely to rise significantly, which it actually didn't. Anyway, when the slides come out, you'll see there are loads of great case studies and loads of videos about the difference to people that this particular project has made. So next slide, if I can, please. So I just wanted to summarize some of the performance part of this. This was the outtake from one of the slides that I showed early on the start, and just bearing in mind that we do have this running average of about 800 people unemployed in the location. The fact that actually we've had some engagement with about 616 in the course of an 8-month program, operationalized at least, is really very impressive. But actually the key bit here was we never actually planned that we would deliver any jobs, and we've delivered 100 jobs or job offers into the NHS and 52 to other sectors. So in terms of this work at a broader anchor level about improving social and economic well-being as part of the objective 4 of the NHS is really important to hold on to as well. And the other part of the if you like, we've already heard reference to sustainability. The point we're at now is about trying to actually make some sense of what do those figures tell us in terms of value. And I've hugely underestimated the social value return on that slide. It's actually considerably more than £1.5 million as calculated by some existing frameworks. So these are emergent pieces of work that we are in Mid-South Essex Anchor Programme continuing to focus on, because the challenge, of course, is going to be sustainability for a lot of this work. Next slide, please. So we have moved on, excellent. So I thought it would just also be helpful to share some of the challenges in that cohort of 600 people. A lot of it is about myth busting and about making the NHS feel attractive to a wide range of people who perhaps had never thought of it before. But we had to overcome some hurdles on that way, people's confidence, their digital skills. You know, if we think about the mandatory training, that is almost the first thing you do, having been made an informal offer. All of that we found needed some support, and so to avoid people dipping out even after they'd had an offer was really important. So lots of stuff about education, skills and confidence and myth busting that all comes together to help us to tune up our delivery to make the project perform to its maximum potential. And the cameo there is sterile services. We have a Southend contamination plant. Those jobs manning that are really Marmite jobs. They are shift-led, they are repetitive, they require extraordinary detail and attention to the detail. You know, we simply can't afford to get that one wrong. And it's been an ongoing challenge to us and requiring lots of agency investment. And actually, we've turned the corner on that one by being able to staff up from our cohort of people who perhaps hadn't worked for a while or wanted to get back into the workforce post-pandemic and are taking that journey with us and with sterile services. So we work collectively together across our divisions and our departments to achieve much of this. So a little bit more learning and added value on the next slide that will help, I hope, to summarise before I get to a very final slide and try to keep us to time. So the learning and the added value, actually, when we think about all of the other support that is around somebody who's lost their work, in terms of restart, in terms of all sorts of employment providers that are there to get people back into work, actually, their knowledge of all of the range of offers that we can make and the different careers and work choices is enormous. And actually that's been a real sort of both a privilege and a challenge to try to make that happen in a better, more efficient way. Actually, many of our participants have had umpteen offers about skills development, umpteen offers of digital training, and actually what they want to do is to work. They've had some of that disappointment of making effort, trying to upskill themselves, and then actually there's been, as many describe it to us, a bit of a road to nowhere. And actually this is the difference with this project, that we can actually really turn that into reality. And in doing that, we've had to flip our often regular application process. So we do events now where people are interviewed before they actually do the job application. So they have a tentative informal offer even at that stage, and that encourages people to go and complete their application form and take that journey with us. There is that challenge. We've lost about 50% of or a third rather of those people who have found jobs elsewhere in the sector. And some of that is about the support we provided, them not realizing that the health world is not quite for them, but actually the bigger story underneath is the amount of time that it takes to onboard people with fractured histories, whether that's housing or employment, appears to be quite significant. And in that time, in the current market, people need to work, they need a job, and they will take the first offer that they get to get back into work. So it's an important piece of learning.
Just the last minute.
So, final slide, which is about actually what change and difference does this make. So there's a sense here about us changing lives. When you look at the videos and the case studies, we have people who are homeless, people who have substance misuse challenges, people who have offended about at a low level, newly arrived people to this country, and those returning to work having stepped out for whatever reason, so often older members of our workforce. So that helps people to change their lives and the lives of the people that support are part of their worlds as well. So that's a really important thing to sort of state that straight out and up front. But also what we have for the NHS and our partners, we have a change to the way that we are beginning to recruit people. We have something that works efficiently with the existing commission support, employment support provider market. And it's that ability to help the NHS to achieve its objective 4, which is super important. And from a community's perspective, most of the research would indicate that wealthier, in other words, working, is generally healthier. It's not exclusive science, but there's a body of evidence that suggests that that's a positive step forward. So thank you very much.
Fantastic. Thank you so much, Kevin. It's been really wonderful hearing more about that initiative. And yeah, it sounds like it's just going great guns, great speed. So that's absolutely brilliant. Final contribution today comes from Blackpool. Welcome, Heather. Lovely to see you here. Thank you so much for joining us. You've got a case study on the co-design of an anchor framework for the Blackpool teaching hospitals, and a video, which is lovely to have a bit of change of media as well. So I'll give you a shout when we've got 3.5, 4 minutes left so we can get the video up on screen. But for now, I'll hand over to you so you can take it away.
That's great. Thank you so much. Hi, everyone. So in the interest of time, can we skip to the 3rd slide, please? So just to explain about Blackpool Teaching Hospitals, we're an acute and community trust, and we serve a population of about 330,000 people. The area we sit in, the Fylde Coast, experiences some quite wide inequalities in both health and wealth, but the coastal areas in particular are predominantly deprived. Those areas are characterised by poor private sector housing and insecure and seasonal employment. And these conditions drive poor health, but also the conditions of the housing and the cheap housing mean that we also import poor health because we have quite a high transient population. We wanted to pursue this idea of a anchor framework for the trust and for other coastal areas because we were quite early in our anchor journey. We didn't have anything at the start of this process, but we are the largest employer in Blackpool. We employ about 8,000 people. We've got a budget of about 600 million. So there's a real opportunity here. And then across the Fylde Coast, we have an ambition to co-produce with our communities. And so if we were starting something from scratch, we wanted to start that and test a model of co-production to make sure that we've got our community who know what the solutions are, who are central to it. Next slide, please. So our aims, obviously I've said we want to produce a framework and test a model. We wanted to recruit 4 community researchers. So these are people with lived experience of multiple disadvantage. And it was important they were embedded in the research team at the Trust. So they had IDs, email addresses, laptops. We wanted to work with our communities and we wanted to do that through our 3rd sector. So the bulk of the money that we got went to the 3rd sector to support that work. We wanted to listen to our staff to understand what they saw and the challenges and opportunities of anchor approaches, and also with partners, a lot of them in Blackpool in particular, who are much further on with their anchor ambitions. So we wanted to hear what they do. Next slide, please. So the process, what we went through. So we recruited 4 community researchers in January, and we spent February to March co-designing the research methods and building the team. It took until June to get our researchers fully inducted to the Trust. So what Kevin was mentioning there around kind of IGHR, we've learned a lot there. I'll talk a bit more about that. July to August, because we knew we wanted to do this as research, we had to get ethical approval, and anybody who's been through that knows how challenging that can be. So we started in earnest in August. We ran a survey with Trust staff, other anchor organisations and community anchors to just set the scene and ask them what they thought about what we did and what we could do. 67 people filled that in. And that then shaped the agendas for some focus groups, which were led by our community researchers with the same key groups. And we had 27 people participate in those. Over the last 2 months, we've interviewed 36 people, so 24 professionals, and then 12 people from our disadvantaged communities. So those were people, for example, from who were experiencing homelessness, who'd left prison, who were insecurely employed or unemployed, children who were NEET, etc. This month we've been coding data, analysing it, and then doing a literature review of other frameworks to kind of get some inspiration and grounding for our framework. And then this week, in fact, we're going to come back together as a research team to co-produce some potential statements that we might use in our coastal framework. All the way through this, we've had weekly meetings as a research team, so with our community researchers, to provide peer support and keep the project moving. And also we've had a monthly stakeholder meeting with some key organisations across the Far Coast and key people in the trust, so exec directors, non-exec directors. Next slide, please. So reflecting on what we've learned, it's no surprise co-production is challenging. Embedding people with lived experience in a public sector organisation is time consuming. We've identified we really need to simplify our processes if we're going to include people with lived experience. We need to look at the IG and HR. Balancing the principles of co-production and hitting deadlines was also a challenge. So we've extended the deadline of this project twice to allow for that. But I'm not sure we've still got it right, because we had some feedback about how co-productive the work was from some of our researchers. We thought we'd spent the time kind of, sharing power, building the team, understanding the model, but we need to do a bit more of that going forward.
Just another 30 seconds or so, Heather.
Thank you. And then we need to engage with other groups differently, so particularly private sector and young people. The setup in the trust meant that we've been able to do this project. We've got a great R&D team, myself, and then the opportunities in the Fylde Coast. We had a co-production unit at the council. A model that's done elsewhere might look differently. And then finally, we've raised expectations. Other partners are really wanting to work with us, so we're going to have to take a lead on this going forward.
Fantastic.
Yeah, thank you. So yeah, there's a video now to hear from the team. So yeah, I'll let that go.
Thank you so much, Heather. And there's some requests in the chat for results of your lit review. So if you want to have a look, and if you're able to share that, Carol has shared her email there. Can't wait to hear from the voices themselves. So Jahan, over to you, and we can play the video.
I believe the focus group provided valuable, honest and open insight and learning for the Anchoring project.
It's been great to be part of our project management team, which has brought together different members of our local community, people working in the statutory sector, the third sector, and most importantly, people with lived experience of health inequalities. And we've all together made this great contribution to produce our framework. It's been a real co-production effort.
I think the project went incredibly well. I am incredibly proud of the project team that they stuck to the principles of co-production. The impact that those co-researchers have on the research itself, cannot be underestimated.
The Chief Medical Officer's report last year made it quite clear that poor health outcomes are disproportionately high in coastal communities such as Blackpool. So as living standards see their biggest slump in decades, it's more important than ever that we do something about it.
This project is important to me because I am from Blackpool. I was born here. My family live in Blackpool. It's my community and therefore my duty to take up any opportunity to feed into its future. Additionally, I work with homeless people, so I see on a daily basis the health inequalities, deprivation and challenges that individuals face here.
I became involved in the Anchoring on the Coast project because I was part of developing the Blackpool co-production model and testing that concept in the Head Start programme, and was incredibly excited about being able to take that model and to embed that in different parts of the system. So of course in this project, in our health system at Blackpool Teaching Hospitals.
I hope the framework will help to address socio-economic and health inequalities by ensuring access to year-round, secure, quality employment and contribute to a stronger local economy.
I hope it will identify and target some key areas of health inequality, gaps in service for the worst deprived people. I hope to see improvements in the Trust's waste management and the way it uses power and heating more economically, more efficiently.
What I want to see for the future, and I think this is part of an exciting vision that we have and we hold together, is that actually members of our local community, very often those people most socially deprived, most marginalised, feel that they are actively involved and engaged and understand what their local anchor institution, namely Blackpool Teaching Hospitals, can do for them.
And generally, I hope that the value, the social value of the resources of Blackpool Teaching Hospitals have a tangible impact on the local community. So I have lots of hopes for the project. I'm really excited to see how that's going to play out. Thank you.
Fantastic. What a wonderful way to end that tour de force of 5 of the brilliant pieces of work that are happening in anchor organisations across the UK. Thank you so much to all of the speakers who've joined us. There's just a couple of small things we wanted to share with you now in terms of next steps and a very quick evaluation of the event. Here are some of the ways you can stay in touch with us. If you're not already on the newsletter, this is how you can do that. You can drop us an email at hello@hound.org.uk and go to get signed up to the monthly newsletter, which is great and has lots of these kind of case studies coming out in it, as well as links to other resources. Do have a look at the new case study section on the website. There's 8 of them there, I think, at the moment, and there'll be more coming up over the year ahead, and Jahan has been dropping a link into that in the chat as we go through as well. We're on all the socials, and there are some fantastic events coming up in January, including one on leadership, which I think is going to be really, really wonderful. So do take a look and sign up or forward to a colleague if you think anybody else would enjoy those. I think we're going to share a quick poll with you that's a very short piece of event feedback to help us make these events even better. So please add your feedback to that. We'll keep it up for 30 seconds or so, and then I've got one more thing to tell you, and then we can let you go about your Wednesdays. So how useful and interesting have you found the event? I'll give you another 20 seconds or so just to reflect on that and add in. And you will have also seen in the chat a link shared by Matthew, who is working with SQW, who are doing some insights and evaluation work of Hound. If you could click on that link and you have 10 minutes to spare rather, that would be really, really helpful. Again, all of this insight helps us to improve the network and improve the offer that we can make to you via the events and more. So really appreciate any time you're able to take to do that. And other than that, I think it's just to say, again, a huge thank you to all of the panelists. I'm so pleased we managed to get through that, because there's an awful lot more you could have said, a huge amount of content, lots of learnings, and that recording and the resources from today will be up on the Hound website soon. So huge thank you to everybody, and I hope you have a wonderful rest of the week.